And we thought to ourselves, my, this is terrible. The woman is considered the caregiver in Africa. And when the caregiver is sick, there is nobody to take care of the caregiver. And for me, it reminded me of my life. I thought, oh, this is what could have happened if I was dying. It's only my children who could have been there for me. And it broke my heart, and I thought, we need to have a place where we can take care of such women. Because let's say we cannot walk in 100 houses, but if we had a central place, then we can bring them there, bathe them, clean their children, have a central place, have a few people who are doing the work, give them food, and maybe take them back to their homes in the evening. Women we were trying to reach to, when I left their houses, all their neighbors now knew that they have HIV because people knew me. And that in itself was traumatizing our clients. So we thought, well, if they just were picked with somebody who is not Patricia and bought at the center, and they came at the center and stayed at the center and rehabilitated back, then the stigma, the trying to take care of somebody and then finally they die would not be there. Then when we started, the week we were just opening, it was not a woman, it was a man. And for the first time, I was realizing men are also stigmatized. I always thought that men cannot be stigmatized. But this man who had nobody to take care of him, he had a wife who goes out to work now to bring just a meal back to the family. And he was sick and he cannot take his ARVs. And so he was dying, that he felt that he was dying that day and just crawled to the road.
Niambie daktari akaniambia niende ward. Na nikaona nikienda ward na siambia watu nyumbani itakuwa vigumu. Nikaamua kuje nyumbani. Na kwa ile hali natoka ndani, Mama Patricia akanifuata, akaniambia usiende, enda ward wakuhudumie. Nikamwambia paka watu wangu wajue kwanza ndio nikuje. Akanipea transport, nikakimbia hapa, nikawaona, nikawaambia iko hivi. Ninaenda ward. Baada ya kutoka ward, nikapelekwa kliniki huko Discover huko. Mimi ndio nilikuwa first client.
I suffered as a child, and I can still remember some of the pain I went through as a small child. At the age of 9, I was already wishing we were not poor. And so when I see a vulnerable child, it makes me think of my past. And it makes me feel of how they feel. And most of the times I realize that people don't know that children have feelings. So they remind me of my feelings as a child. The first child that we got at the center, that was the first time I realized, wait a minute, it is possible. That is Churchill. For me, the worst scenarios that I never wanted to see is children dying of AIDS. That one was pain to me. I didn't want to see it. I didn't want to imagine it. And Churchill's life really encouraged me.